Hello and welcome everyone on Earth Day today. This is episode, oh my God, 28. And this episode is particularly tantalizing. But before we get in and introduce our amazing guest today, Sabine Hazan, we're going to just show up, who we are. We're the new MDs, mothers, doctors, and scientists. We are all mothers, doctors, and scientists, just so happens. And I have my dear friend and colleague, Dr. Stephanie Seneff. I'm a MIT researcher, scientist extraordinaire, author of Toxic Legacy. I'm Michelle Perro. I've been practicing pediatrics, environmental health for 43 years. There's my book, What's Making Our Children Sick. And today's guest, it is our pleasure and honor because I am like a girl fan of Sabine Hazan and who owns Microbiome. And here is Sabine. But Sabine has been digging deep into poop. I love that word. I cannot help being. And today we really want to focus on poop and mental health in our children. That's like the focus of today. We could talk about bugs forever, but before we start, Sabine, can you share a little bit about yourself, how you got into the love of bugs, and give us a little bit of a paint the palette for us, if you would.
I don't think I started off with the love of bugs, to be quite honest. I was kind of a sterile kid that didn't like to play with poop. Let's just start there. But I'm a gastroenterologist. I started doing clinical research for about 3 decades. I started at University of Florida in my first year of internship with Dr. Sami Alkan. And Dr. Akam used to say, you're really good at research, just keep going. But then somewhere along the line, I started doing GI because, you have to be a doctor on the front line, taking care of GI bleeders and everything. And, as I had kids, I started doing more research, less GI, clinical GI, and then, pharmaceutical trials, one after the other. When feces became a capsule, of pharma, literally, one could say I went rogue because I saw on my desk poop from, in capsules as a new concept of pharmaceutical drugs from China, Korea, America. And I said, wow, we're in the poop business, pharma, literally, and we have no idea what the hell is going on. And so I started Microbiome with really an interest in understanding the microbiome, with really an interest of what am I seeing when I do fecal transplant, the process of taking stools from a healthy donor and putting it in a patient with C. diff. C. diff, a condition where people have diarrhea from taking too many antibiotics. So basically that's been the path. So little did I know that, what you showed on the logo of Microbiome, which is really starting a healthcare revolution. A little did I know that I was really starting, the quest for a new healthcare revolution. I came up with that, it's sometime in 2018. And COVID hit 2020. And we've been in the middle of this healthcare revolution, right? And so my vision that I had in 2018 really is coming to start opening up. So I am the CEO of Microbiome, a research genetic sequencing lab. I tell everybody it's research because the microbiome is trillions of microbes. There is no possible way that I know it all. I'm lucky if I know 1%, if not 1 in a trillion. And I think a lot of people. But this is a fascinating field. Here I went from sterile environment, clean person to literally collecting stools of elephants, stools of people in Zimbabwe, stools of people in the Philippines, stools of Americans, Italians, you name it. And it's fascinating to see what we see. It's like being, Indiana Jones and just discovering all these microbes and what they're doing and their interactions and what disease they're part of. It's fascinating.
Well, you are a microbiologist, scatologist, gastroenterologist. Easy for me to say. So this is a perfect segue to start to understand. But what we're trying to tease out today is this relationship between mental health in our children and the disorders. And I hate that word, mental health disorders, as if we're cut off at the neck. There I prefer neurologic disorders, but there's a as we know, there are classifications. It calls a DSM-5, and people have all these diagnoses listed, and we bill based on diagnoses. So it's terrible labeling, but we know that pre-COVID and during COVID, mental health issues have skyrocketed in children. We know that. And we're going to focus on a few of them today. But we thought because of what's happening right now with Secretary Kennedy, we love you, Secretary Kennedy, is autistic spectrum disorder. And he just got the ball rolling, releasing, we're Californians, so Sabine, Stephanie kept going further west from us, with now in California, 1 in 12.5 kids on the spectrum. I think Dr. Sedef reported
boys.
Boys.
1 in 12.5 boys.
Boys, because it's 4-to-1 ratio of boys to girls, 3-to-1 in some studies. I think Dr. Sedef, you said by 2025 it'd be 1 in 2. You're not that
2032. 2032 born in 2032. I'm still holding that one unless we fix things. 2032 born in 2032. Those kids will end up, half of them, on the spectrum. That's my prediction.
So we're hoping not to get to that prediction. And we know that people talk about mental health has been secondary to lockdowns, school closures, masking. Yes, we know that. But what do you think might be driving? Let's get into it. From your perspective, what's driving? Let's start with autism. It is a DSM-5 classification. It's listed as a disorder. Let's give us I'd love to hear your take, and then Stephanie and I can jump in and we could talk a little bit about this.
So if you look back at my study on fecal transplant, and it was an N of 1, a kid that we did fecal transplant using his sister's microbiome. And what we showed was basically engraftment of the microbiome, disappearance of a microbe that was what I believe was not a good microbe in that patient. And then essentially elevation of good microbes, bifidobacteria, primarily. And bifidobacteria, an important microbe in immunity, an important microbe that started the whole world of probiotics. So here's the thing, when you look at these kids, and I've analyzed, so when you look at the before and after, right? I always say, to understand the microbiome, you have to practice the art of medicine. To practice the art of medicine, you have to be bold. You have to make decisions on treatment that you would not necessarily go there because it's outside the box. And I'm in an interesting situation because I own a clinical trial company that's done hundreds of clinical trials for pharma. So I know how to innovate a protocol, how to put it through the IRB, how to submit it to the FDA, how to give it a designation of breakthrough. So because of that, I permit myself in a way to step outside the box, right? Personally, I think the only way to practice medicine is outside the box. I was just thinking today, how crazy is it that we've stopped the art of medicine and have just embarked into clinical trials? Where is the practice of medicine gone that we really need to have the FDA holding our hand to do clinical trials, So what happened to innovations? What happens to practicing an informed consent between the doctor and the patient? So when you look at that case where we improved the kid that went from nonverbal to saying a few words, to slowly adapting to the house, to not being aggressive, to engrafting his microbiome, matching his sister. When you see that, you go, what happened? What changed? And what you see is a gut dysbiosis that changed. Now you extrapolate that to, 20 kids, and we're just publishing a paper. We published it as an abstract at the American College of Gastro, but we're just publishing a paper where we basically took 20 kids that were autistic. We compared them to their 23 siblings. Okay, so 23 siblings, neurotypical, and 20 kids, non-neurotypical, autistic. And then we compared them to 6 kids that are non-neurotypical, that are neurotypical, but no family history of autism, no one in the family with autism, completely outside of the house, right? What we discovered is the kids that had autism lacked a very important microbe. And I'm going to focus mainly on bifidobacteria, because bifidobacteria is the microbe that newborns are born with, right? You see a lot of bifidobacteria in newborn. The process of aging is that loss of bifidobacteria. So when you see 20 kids with low bifidobacteria or absent or not adequate enough for their age, and then you look at their siblings and you notice they have a lot more bifidobacteria, but then you look at the other 6 kids that are much higher and you go, wait a minute, even between the neurotypical and the autistic kid, they're not as good as the kids that are not in the household, right? So definitely a gut dysbiosis. Now here's what's amazing, and what I'm publishing 2 cases, and I always tell the data before it gets published because I'm so excited about it. And besides, I have nothing to hide. They can come. The FDA has been in my office. They can look at the charts. They've interviewed the mom with the kid with autism, so they saw the data of that kid with autism. So I had 2 twins, identical twins, nonverbal, aggressive, the same 3 microbes present in both twins, elevated at baseline. Same, imagine, out of trillions of microbes, the same identical microbes. Now that's called a validated assay. When you can reproduce out of trillions of microbes the same exact in twins, you've got a validation. Now, the other thing they had in common, both of them had 0 bifidobacteria, 0 at baseline. We focused on killing the bad and increasing the good. And guess what? 7 months later, the 2 twins that were 6-year-old, now 7, are fully verbal.
Wow, that's so wonderful.
Non-aggressive. So if you follow the microbiome, you get to see the answer. You get to see what's happening to these kids. You get to see these microbes are going from the gut, traveling the nerve, going into the brain. Yeah. It is a crime to ignore that. Yes, of course, there are kids that are superstars, on the spectrum, that are out there, that are geniuses, right? And that are verbal and they're highly functional. Okay, great. Those are not the kids I'm talking about. Talking about the nonverbal who bang their heads on the wall. Those kids, we need to pay attention, where the parents are picking up their 17-year-old kid to put them in the room, where the parents cannot sleep at night because they're worried that the kid's gonna break the toilet, for example, or leave the house. So this is a crisis that we have. And the fact that there are so many in California, it's unacceptable that we're not paying attention. And it is also unacceptable that we're putting all our funds into rehab places for these kids, but we're not doing the research and the therapeutics fast enough to correct these kids.
So it's really great that they can be fixed. That's something I had wondered for some time. And I now know, I've met people who were diagnosed with autism perfectly normal. So that it can be reversed. And that is so satisfying to know that there's a healthy human being inside if you can just straighten up the gut microbiome.
Well, you've heard it from various moms that have gone this path. There's a kid inside. You've heard Warrior Mom. Tracy Splechnik, who basically talks about the way she treated her kid. And these moms again are warriors. So it is possible. But here's the thing: what's impossible is to not come to terms with what's happening. Right.
The impossible part of it is that, when I wrote that book, I wrote it because I was reversing autism. It was based on healing the dysbiosis, and dysbiosis causes leaky gut, re-regulating the gut-brain microbiome axis. We call it the gut-brain microbiome and not just gut-brain axis, which goes through the vagus nerve, the main nerve in the body. That is called part of the enteric nervous system. And it's focused on bifidobacteria. But this is what is happening in the integrative space, not in mainstream. Mainstream only supports a cognitive type of therapy for kids with autism. And it's a $4 billion industry. And they're locked in there. And they don't want to hear about us taking out inflammatory foods and altering the microbiome. God forbid we talk about fecal transplants. That was verboten, although we've had such great clinical successes. Yeah. So this is like another part. And I just want to say what's happened to so many families when kids with autism, they know when their kid changed, and when they told their pediatricians about it, they were gaslit. So they had to exit mainstream medicine. So many mainstream pediatricians are saying, I don't have kids like that, because those families all exited. So they're paying insurance for a system that is not capable of providing the care they need, which is essentially gut rehab and restoration, which is
And the problem is they don't know, right? These pediatricians do not know. They think about medical school. How many classes have you done on nutrition? I mean, I was lucky. I did a minor in nutrition in my Bachelor of Science. So I was very in tune with the nutritional aspect. And then also GI, we have nutrition. But even in GI, nutrition is really, I remember the boards of GI, maybe 10 questions, on vitamin deficiencies. So I think, the problem is we don't train nutrition. And here's why we don't train nutrition: because nobody really understands nutrition, really. I think we're going to start understanding nutrition a little bit better as we look at the microbiome.
For sure.
Because now we're starting to see, well, this microbe, like think about bifidobacteria. Who knew bifidobacteria liked vitamin C and liked vitamin D, and that it grew? We saw an in vitro study, but nobody's ever done a clinical study where you give people vitamin C until our lab, where we basically took 20 patients and we gave them vitamin C before and after, and noticed vitamin C increases bifidobacteria. Now it's like that light bulb, right? That comes out that says, wait a minute, a patient has COVID. He has loss of bifidobacteria because he has COVID or a virus, right? Any virus. And is this why vitamin C is helping with viruses? Because it increases the bifidobacteria that those people are lacking to begin with, right? So are these microbes depleted in nutrients, and what nutrient feeds each microbe? This is the future. So it's going to change nutrition a lot.
What you're saying is so relevant for people listening to this podcast, because people are saying bifido, what the heck is bifido? Well, people may not realize that breastfeeding, there's something inside breast milk called human milk oligosaccharides. Every mom has their own unique profile, 50 to 200 of them. Those complex of proteins and carbohydrates are food for bifidobacteria. The babies can't use that. So there is a design in place. This is how important bifido is for nature, because 100 years ago,
Yes.
if you looked at a fecal smear, a newborn baby was a monoculture of bifido, and now they're not. Our babies are different.
Yes, but still there's some out there. I call them the golden poop, okay? There are some out there, but they are very, very rare. And this is why, I started this whole hashtag Save the Biff, because I realized, my God, what are we doing to our newborns? What are we doing? What happened? What has changed so drastically that the newborns, like you said, was a monoculture of bifidobacteria. And now all of a sudden, they have diversity as a newborn. They have multiple other microbes as a newborn. They have loss of bifidobacteria as a newborn. You have to start. And then when you look at autism, or you follow these kids with autism, the majority is probably going to have loss of bifidobacteria and end up being on the spectrum or autism, or even develop diabetes type 1, or develop some autoimmune, or develop some, we showed loss of bifidobacteria in autism. We showed it in long haulers. We showed it in invasive cancer. We're showing it in type 1 diabetes. So this is a big problem, that we're missing a whole group of microbes that were the beginning, the signature microbiome of a newborn, right? And the other interesting thing about bifidobacteria is it decomposes plastic. Do we have a plastic problem, or do we have a loss of microbes because we've killed so much?
And we would be remiss if Stephanie and I, who've been at this for a few decades now, didn't talk about one of the driving factors that kills off bifidobacteria is glyphosate. It kills bifido and lactobacillus, and it promotes the propagation of Clostridial species and salmonella. And we've shown glyphosate in infant formula. I don't know if we want to get into infant formula right now, but there's a point that I want to bring up, and perhaps we can get into this because we're kind of off topic, but let's just get right into it because you're here, Sabine, is such a treat. So we know that babies now are born with an impaired microbiota. They don't have, it's not robust. They don't have microbial diversity. They are inherited from mom. Mom is the stewardess of the microbiome, and grandma and great grandma. And we don't talk to parents about how to fortify their microbiome before birth. So we could talk about that. But babies who inherited this lack of robust microbiome seem to have more adverse effects, for example, when they're vaccinated. And there is increased adversity. Okay, we're gonna go off Facebook right now, and YouTube's about to shut us down because I said word. Go ahead.
Yeah, don't even go there. Don't even go there. Just
So
call it.
let go, folks. If you're listening, go on Rumble, go on X if you must, because we're going to be shut down in a second. But I'm just talking about this needs to be studied as well because babies who have a robust microbiome do better with vaccines, and those who don't have more adverse.
Right. And this is where the science needs to catch up, right? This is where the science needs to say. You remember when you were, I trained in Miami in Jackson Memorial Hospital during the peak of HIV. There was no question. In fact, it was malpractice if you gave an MMR to an immunosuppressed patient, HIV patient, right? Because you're giving, even though it's attenuated, you're still giving a piece of a virus, right? 3 of them. So there was no question. That was like the big thing on the rounds. Do not give MMR live viruses to HIV patients because they're immunosuppressed. Now, these babies, forget like 100 years ago, okay, when we didn't have this problem. Right now, we have a problem. The problem is our children are born immunosuppressed. And by immunosuppressed, I'm calling it out already, loss of bifidobacteria.
Me too.
You're lacking the good microbes. What is your defense against a virus? What is your defense against a parasite? What is your defense against a fungus? You have no defense. You're left. So we have to start paying attention to the kids that are becoming autistic, to the kids that are immunosuppressed. We don't even do a blood test on these kids to know. Right away, they get the shot without even a blood test to know if they're immunosuppressed, without even a history in most of the cases. So, here's the problem. If the vaccine is live, right? And the viruses are live, even though attenuated, small amount, it goes in the blood travels to the colon, right? It doesn't just stay in the deltoid like they made us believe during COVID. It travels to the brain, to the heart, etc., but it travels to the gut. That's where it starts living with the microbes. And what did we learn from COVID? What do viruses do? They kill good microbes. They create a bacteriophage. They create a bifidophage. So in the gut, in that little colon of that baby, it is possible that those attenuated viruses kill. And here's the thing. In a kid that's robust, good bifidobacteria, doesn't matter. He'll kill a few. He still has the virus in him. He can survive. But in a kid that's immunosuppressed, in a kid that's had previous allergic reactions to vaccines, that kid is already giving you the history that there's a problem there. In a kid that's having seizures after a vaccine, that kid is already telling you the story. That kid should be handled carefully, and that kid, we should boost the microbiome first before giving it a vaccine. The concept of vaccine is not a bad concept. It was a good concept, right? Replenishing the body with little minutiae of bugs. But here's the problem. What are you putting in those vaccines? Are you putting too much aluminum? Are you quantifying the microbes, or are you having a contamination? I mean, we're trusting pharmaceutical companies and factories of people that are probably underpaid and overworked to make sure that every single vial has the same amount of products in there. They're not. There's a poor quality. That's the way it's going to be. So we need to be better. We need to be more attentive to what we're doing.
There is so much to unpack here, Sabine, and I'm going to get us back on track. But before I just have to say a shout out on why GMO science. I've been concerned about genetically engineered microbes that are swapping plasmids, which are little pieces of DNA, with our own microbiota, creating new organisms, new metabolic products, which modulate our brain function. What those organisms are, don't know. Have they been studied? Absolutely not. The COVID vaccines were genetically engineered. Hep B vaccine genetically engineered. Insulin is produced by an engineered E. coli. Our food, especially food, all the food kids eat is genetically engineered, included soy, corn, hopefully not canola. It's all engineered, and sugar from sugar beets. So we have created a new microbiome, and this is what I'm worried about. But let's get back on track. But before we get into bipolar dysbiosis, abnormal microbiome, ADHD dysbiosis, major depressive disorder dysbiosis, they're all dysbiotic, schizophrenia dysbiosis, Alzheimer's dysbiosis, Lyme disease dysbiosis, etc. I think the point's made. What we thought we'd do today, we usually save solutions to the end. But as my dear friend and our colleague Ruth Westreich likes to say, we are solutionaries. Her word, not mine. I stole it. And we created a top 10 list on how you restore a normal microbiome to give people something they do. And here are some solutions. And here's a list we created. Now, this is common sense. Next slide, Anne. This is what we've created. We talk about these things. You can take a look. You can see, folks, you can take a screenshot if you like. This will live on GMO Science. It's a PDF in our new MDs. Next slide.
I'll caution you. I'll go back to the slide.
All right.
I caution you on apple cider vinegar and probiotics.
Well, yeah, let's talk about it because we'd love to hear.
Fiber, I'm all for that. Okay. Fermented food, no harm there. I'm all for that. Apple cider vinegar. Think about apple cider vinegar. What is its purpose, right? How did penicillin get invented? It was a fermented apple, right? What is apple cider vinegar, right? So I tend to believe we're going to have some data on apple cider vinegar, but I tend to believe that it could have a potential of being, bactericidal. And therefore, if you're building a microbiome, it's great if you have like microbes that are toxic, not so great if you've got, trying to grow those microbes, you've killed your microbiome, you just got a new microbiome, you definitely don't want to kill that. So I caution people about apple cider. We're doing some research on it. It's not conclusive, but I would say caution, okay? Probiotics, let's talk about that.
Let's talk about probiotics. Everybody
this is an argument that I have with people that make the probiotics. In a world of where you own a company and you influence a product, you're not really unbiased, right? You're kind of thinking, well, this is good for everybody. However, I think that the people that have a good bifidobacteria should not be taking probiotics. I have a problem with kids that are healthy and we're giving them probiotics. Why? They have bifidobacteria. Let that grow. Give it the fiber, give it the vitamins. So I really caution, and we're going to start showing the data on probiotics, who should take it, who should not take it. And also the other problem is, as I've showed in the data with, the yogurts, 26 out of 26 yogurts, only 3 of them had bifidobacteria, right? And it's not my job because everybody has texted me, emailed me, tweeted me, messaged me, asking me the 3 yogurts. It's not my job to give the 3 yogurts. Why? Because one, I want to protect the factory so it doesn't get bombed. Okay. We're not living in a normal world now. Okay. Second, I tested my region, my area. What if I tested just one yogurt of that brand? Am I going to kill the whole brand? Maybe that yogurt didn't have enough quantity. I didn't test the factory in North Carolina or South Carolina or Georgia. I tested in California. Maybe the quality was poor in California and they forgot that day to put bifidobacteria. Who knows? So the thing is, you cannot really trust the yogurts. You cannot really trust the probiotics. We showed that 16 out of 17 probiotics on the market do not have bifidobacteria. Now, here's the problem. If it doesn't have bifidobacteria and they lied to you about what's in the product, what if there's other stuff in there, like arsenic? So now mom goes to the pharmacy and thinks that she's freaking out. She's panicking about her newborn baby, because you know how we are as moms. I was the mom that was over sterilizing for my first kid. Second kid, I just let her eat from the floor. I'm like, eat from the floor. It's much better for you. First one, I was sterilizing everything, right? So we tend to be these mother hens, overprotecting our children, I think that's probably why we all stood up during the pandemic, is because we're like, you're doing what? You're giving what to my kid? No. I want to see the good data. I want to see the research. Stop lying to me about the vaccine stays in the deltoid. Stop, influencing my kids with French fries to get a vaccine. Show me the data. It's not that hard. Show me the data. So we tend to be overprotective. I don't want to have moms freaking out that they feel that they were exposed, that they got vaccinated, and therefore their baby doesn't have bifidobacteria, and then they give bifidobacteria to their babies, okay? I really want to encourage the culture that was before the probiotics, before all that. What did we do as moms? What did our moms do to us? I can tell you, my mom wasn't giving me probiotics, right? I mean, she was giving me my milk, honey milk. We were in Morocco, so she had like milk with honey. That was, what the kings were drinking. Every mom did different things, but somehow we grew up fine, right? We still are alive. Breastfeeding, very, very important. So fermented fiber, yes, check. Fermented foods, check. Fiber, check. Breastfeeding, check. That's not even debatable. If you can breastfeed, breastfeed. Now, here's the mom who should not breastfeed. The mom who newly got a vaccine should not breastfeed. The mom who got antibiotics should not breastfeed, right? The mom that's a drug addict or alcoholic should not breastfeed. Those are the moms, but the rest of the moms, breastfeed and put yourself in a zone to be zen when you're breastfeeding. Enjoy your baby, get that energy from your baby and give it back to your baby. So that's it. We can go to the next.
So we can go to the next, but before, the difference between, and thank you for that, and we'll get through this, and then we'll get back to our other mental health challenges, but the difference between us and our present children is we didn't have the amount of pesticides like glyphosate and antibiotic. There's glyphosate if babies are fed infant formula, so of course it's going to knock out their bifido. Bifido is a very sensitive microbe. It's this little bifid microbe, and so we have inundated our children. 97, or not, actually, Zen found 93.7% of American school lunches had glyphosate, infant formula, glyphosate. So we have to remove the chemical toxicants, whether they're pesticides, heavy metals, BPA. They're antimicrobial. They affect them.
Even in the farms, by the way, if you go to a ranch and you watch the practice of taking care of cows. Do you know they put these cows, they dump the feet of the cow in formaldehyde? What is that doing to the cow? What is that doing to the milk? What is that milk doing on my cow? Think about when we were growing up, we had milk in the front porch, right? And we didn't get home till like 5 o'clock. So that milk stayed there from 8 o'clock till 5 o'clock. And then we drank it. Essentially, it was like kefir, right? Because it took time. It had started, having bacteria in there. We stopped those practices. The practice of farming is so overly sterilized too. When you think about what they're doing to the animals, what they're, the multiple vaccines, the multiple antibiotics, the formaldehyde that they use, and then the feeding that has glyphosates. So how do we have sick kids? I mean, start with the soil, start with the meat we're feeding them, start with the milk they're drinking. Let's call a spade a spade. We live in a toxic environment.
And so this is the concept that I want to drive home to folks, is that our kids are not the same. They have an increased allostatic load of all these toxic materials. We're trying to unload their toxic load and give simple solutions that don't freak people out, that don't cost a lot of money, that we can do. And so here's our next 5, because we like 10 as a number. Okay, here's our next set that parents can do at home. People, what's good for your baby is good for you too. I know we focus on children, but this also applies to the grown-ups in the house. What do you think
Yes.
about these?
Yes, sunlight. I mean, you could see I'm suntan. I went in the sun. Love the sun. We need vitamin D. That's a fact. Avoiding antibiotics, absolutely. It obviously, if your baby needs antibiotics because he's got a pneumonia, he's got urinary tract infection, whatever reason, yes, I can understand. But then don't forget to optimize the gut. Don't forget the vitamin D for the baby. Don't forget to give him good food, good fiber, etc. Decrease stress, absolutely, absolutely. Stress kills. Organic food, whole plant, plant forward. You got to make sure that your farm is not using pesticides, so you got to be very careful. The same way that there's products that say they have bifidobacteria in there, but only 3 out of 20 have it, or 26 have it. The same thing goes with the organic food. There's so many organic foods that say they're organic and they're not. And here's the problem, right? I mean, when you don't have penalties, right? Or the government doesn't come after you for fraudulently mislabeling the label of a yogurt, or for essentially putting organic when you're spraying, that's fraud, in my opinion, right? I think what happens is that people are being misled, and there's no repercussions on that, and there needs to be repercussions. Think twice about who you love. Well, that goes for everything, because the wrong partner can kill your microbiome. I can tell you that much.
Well, if you're in a lecture sitting next to the person and you don't like the person next to you, it's probably because your microbes don't like each other.
Probably.
And if you're living in a family, the whole family shares the microbes, including the family cat and dog. So and kids who grow up on farms actually have a way lower risk of atopic diseases like allergies, environmental allergies, asthma, eczema on farm kids. So they're sharing those microbes of the cows and the pigs and all that poop that they're running around in. Okay, thank you for your opinions on our top 10. We're going to get back into some of the dysbiosis that we see in some other mental health challenges. And we know you've been working on this, Sabine, this relationship of dysbiosis, abnormal microbiome, and mental health. And, and maybe, Anne, you want to just quickly show that slide for us on kids and mental health right now, some of the stats from the CDC. We have just a couple of quick slides here. Or I could just tell you what they are, because I know the stats, because we know that this is from CDC 2021, 2022. It's way underreported, but about 10% of kids currently diagnosed with anxiety. Anxiety often goes coupled with depression. They often have comorbidities, and 7% of them have behavioral disorders, way higher. And children of families who have mental health challenges, the families have a way higher rate of divorce. Just saying. And teens, let's look at the next slide, and then we're going to have you weigh in here. Teenagers are not doing well. Our beautiful teens, more than half of them have discussed their mental and emotional health with a healthcare professional. 14% are taking prescription medication. I don't know what percentage are self-medicating, marijuana, other drugs du jour. 20% of teens receiving mental health therapy. It's probably higher.
Higher.
20% of teens having unmet mental health needs. Schools cannot even keep up. Colleges, right now, I got to show you, got it from my alma mater, Yale, and the stress, what's causing the mental health crisis among college students? I just got this a couple months ago. It is a crisis. So let's talk a little bit about this. Let's hear your thoughts. And Stephanie, I'd love for you to weigh in as well.
Well, we discovered a signature microbiome during COVID for anxiety, because if you'll remember, a lot of people during COVID were very anxious. And one wonders whether the virus got in and essentially killed the good bacteria and up the bad microbes. That signature microbe, we started microbiome. We started analyzing, giving a GAD questionnaire. That's an anxiety questionnaire to patients. And then the people that had severe anxieties had a severe leaky gut. The people that had lost, a low anxiety didn't have leaky gut. So it really correlated really well with leaky gut. So anxiety, leaky gut really correlated well. What was also interesting is that in the bipolar disorder, there's also a signature microbiome. There are microbes that are overgrown in bipolar disorder, but there's lack of good microbes that bipolars miss. And the problem is when that happens, you cannot replenish those microbes. And that's why they're bipolar. So unless you do, procedures and find a good donor that matches, etc. But essentially, that's what we discovered. We discovered a signature microbiome in bipolar disorder. So yes, mental health is loss of good microbes and overgrowth of bad microbes. That's the best way to put it in layman's terms. We need to get into that because unfortunately, mental health is high. Bipolar disorder is high. Our kids are suffering. Now, is it because we've diluted their microbiome to begin with? They didn't start off with so much bifidobacteria that by the time they get to be teenagers, they don't have enough to support the stressors of school. But also more than school, the social media, the influence, the alteration of images that make us believe that this is what a woman's supposed to look like and this is what a man's supposed to look like, and that changes the confidence for so many of these kids because they cannot keep up with that. So you add all this and then you have kids that are no longer playing outside. They're on their phones constantly. They're no longer touching other humans or hugging other humans. They're connecting via wave, via phones. So you lose the people contact, you lose the microbiome exchange, right? So you lose that diversity. Some kids, it's fascinating because some kids do adapt really well. Like the Gen Zs, some of them are, have survived some COVID, I know my kids, there was a shooting in Thousand Oaks and, that traumatized a lot of kids and they kind of survived that mental, anguish as well. So some kids become resilient, they become numb, they become tough, right? I'm not saying, they lose their sensitivity a little bit, but some kids, they can't, it's too much for them. They're very sensitive. It's too much you're being fed all this stuff from everywhere. You're being fed fear of contaminating grandma from a virus. So you're paranoid about wearing your mask. And, so mental health, it's so huge. It's not only the foods we eat, our microbiome that's leaky gut, but it's also everything we put on these kids. It's enormous.
So this is a cry to kind of, well, we have to kind of take a look at microbiome analysis because we do it in the integrative world. We look at stool testing all the time, and the more I look at, the less I know. Actually, it's just shocking. Like I really don't know what this means, but we can pick up trends. And for those of us who practice the art of medicine, or I'm a trendologist. I'm looking for patterns is what I'm doing. And if I see repeated patterns, and you do,
Yeah.
the
Yes.
specifics are really hard. But
Yes.
other than doing some stool cultures for somebody for salmonella or Clostridia, C. diff, we don't in mainstream medicine look at the microbiome. So there has to be a
And
massive shift in medical education, teaching. We get a year of microbiology in medical school. Why aren't we learning how to test for the microbiome?
I gotta tell you, the science is new. Okay. And I'm gonna be firsthand to tell you because I've seen a lot of bad data out there on the microbiome. I've seen a lot of bad practices of laboratories. I've seen stool samples that I've sent to different labs and got completely different results. Remember, this is the microbiome, it's trillions of microbes. If your lab is not validated and reproducible, your assay it doesn't matter what you see. You're not seeing anything really. So it's so important to compare apples with apples, to have the same standard operating procedure, to know exactly where you're going to look at the microbiome at baseline. And unfortunately, um, I wouldn't have started Progenobiome if I saw that I could trust a lab. I remember when I started this, I called Howard Young at the National Institute at the NIH. And I said, you won't believe this, but the procedure, the lab, the stool testing are not valid. But then even the bioinformatics pipelines are not validated. In other words, I can send my same stool sample to the same lab at the same time. I'm going to have two different results. But then, even at the level of where the stools go to the bioinformatics pipeline, I can use that library prep and put it through two different bioinformatics pipeline, and I'm going to get two different results. That tells you what you're seeing, what you're believing, it may not be accurate. So why are we not teaching? Well, first of all, we need the government to start working, with companies like me, basically, that is doing clinical trials and saying, okay, well, Dr. Hazan, let's validate you. Let's see if you're right. Let's see what you're seeing. Because remember, the only way to understand the microbiome is to attain a cure and go back. And the only way to attain a cure is to practice the art of medicine. So if we stop the art, where are we, right? So, and everything has to be clinical data. We have emphasized these mouse models, and Stephanie could probably, come into this. How accurate are these mice models? Do they reproduce on humans? I don't think so.
Stephanie, do you want to weigh in? Because I think are you on mute?
Yeah. Yeah, I've been quiet. You guys are carrying on very nicely. I can just relax and not say anything.
Yeah, well, no, but let's hear from the scientific perch, your thoughts.
Yeah, well, I mean, I've been very fascinated by the gut microbiome as well, and I've been studying it a lot with respect to glyphosate. And I've discovered some very interesting things about how everything works, and you have the bifidobacteria breaking down the fiber. So if you're eating a lot of fiber, you're going to encourage your bifidos to grow. And then they're turning that fiber into something that other microbes can turn into short chain fatty acids. And the short chain fatty acids are super, super important in the gut, especially butyrate. So if the colon doesn't have enough butyrate, then the colon gets sick and you get the leaky gut syndrome. And then you get all this stuff coming out. And meanwhile, you've got these pathogens overgrowing, and they're producing products that are toxic, that are getting to the brain through the leaky gut barrier, the leaky brain barrier. All this stuff is happening. The gut and the brain are in such close communication. And another microbe that I have been fascinated by recently is Akkermansia, and you may know something about them, but they are really interesting. Akkermansia, actually, their preferred food, the only thing they eat is the sulfomucins that are produced by the colonocytes. And then they eat those sulfomucins and turn them back into stuff that can turn into short-chain fatty acids. So there's a complete cycle there. But the Akkermansia are eating what the colonocytes are producing and turning it into food for the colonocytes in a cycle. And if that system is working well, the Akkermansia actually produce something that stimulates the GLP-1, which is we have all these GLP-1 analogs that people are spending tons of money for to try to get skinny again. Akkermansia actually causes GLP-1 to go up. the real guy, not the analog. So if you can just get your Akkermansia healthy, then you can probably lose weight in the same way that you would if you took that very expensive drug, So I think getting the gut back in line by eating a lot of fiber, really, to start with, and then by having enough sulfur, because sulfur mucins need sulfur. So there's some critical things you need to worry about in your diet to make sure you're getting enough of these things to keep that system healthy with the bifidobacteria and the Akkermansia. And vitamin D actually increases both of those too.
So Akkermansia, I'm kind of divided on it because clinically we are seeing that it shouldn't be in everyone. Not everyone should have Akkermansia. And then the other thing that we're noticing with Akkermansia is there's a level at which it is good and there's a level at which it is not so good. So, I think, the problem with shows, we have to be careful, because if people listen to, and the science is right, you're absolutely right, the science is there, but if people listen to this show, the first thing they're going to do is they're going to go to the grocery store and get some Akkermansia. And
that may not be the right approach. I mean, I agree with you that you have to be careful. Yeah. But the thing is, too, I know Akkermansia, let me talk about this, because Akkermansia is actually elevated and associated with Parkinson's disease, which is bad. Yes. And I think it's because the guys who take over from the Akkermansia are not working well. That's the guys who make the butyrate. And so because the gut pH goes up because of the glyphosate, then those acid-loving microbes don't thrive. So your Akkermansia is preparing the stuff to make the butyrate, but the guys who are supposed to make the butyrate aren't doing it. And that's all mixed up too. So you've got to worry about everybody else,
100,
not just the Akkermansia.
Forget that the microbiome is just one microbe with another, with another, with another. You alter one, you alter the whole thing.
So there's a big push right now, for example, in psychiatry or mental health and in the integrative space, to use specific microbes to treat disorders like depression. They're using Lactobacillus plantarum 128. Or, you've got, we found some Akkermansia, maybe want to elevate it, prevent your diabetes. You've got Proteus. We want to reduce the Proteus so you don't get rheumatoid arthritis. So probiotic selectivity to treat. Now we're looking at mental health challenges because microbes produce the neurotransmitters that run your brain function. Always made me nervous because when you eat an onion, inulin, food for microbes, there are many different substances in that onion that are providing food. It's not just 100%. One thing. And we have so many microbes that are working in unison. That thing about Akkermansia, some is good, too much is not good. Like I think they say 15%. So it's keeping that homeostasis.
But it also depends on what the other guys are going to be able to do with what Akkermansia is producing. Because if they can't metabolize those into the short chain fatty acids, you're probably going to have a toxic buildup and it's not going to be balanced.
But it's all about this homeostatic balance. And the microbes, I don't like to even think of bad and good microbes anymore. I like to think of that they kind of keep themselves in check. There's a community, and they talk to each other through quorum sensing. So giving selective probiotics for mental health challenges always gave me a bad gut feeling.
We're not there yet. We're not there.
It's definitely being done.
Because everything's a business now, right? So I remember being at a conference in Paris, and the guy was talking about a probiotic, a new microbe that he wanted to bring out as a pharmaceutical product. And I remember him saying, well, if the clinical trial fails, the placebo-controlled trial fails, then we'll bring it out as a food product and sell it that way. So I was shocked because I said, wait, if it fails in a placebo-controlled trial, that probably means that it was just bad. Because as much as everybody's weary about the FDA, I've been doing clinical trials for 30 years, and I can tell you, if a drug is bad, I as a physician, as a clinician doing clinical trials, there's no way that drug's coming out. I will call the FDA myself and say, hey, my guy jumped off the building on that drug. You better record this and come look at it, right? So, although what we saw happen with the vaccine, that was a whole different story, but the FDA does do a good job, in my opinion, of not, bringing out drugs that are killing people, right? So saying if a microbe didn't make it although we could argue on this, but depends. If a microbe, what bothers me is that if a microbe doesn't make it through a clinical trial, that all of a sudden it's able to pass in the food consumption. Because here's a microbe, for example, I'll call microbe X, and I discovered that microbe X is linked with cancer. The last thing I want is a scientist to put that microbe X in a yogurt and feed it to everybody, because now, I'm going to see in the future and say, oh, we're going to have a lot of problems in the future. I already know we're going to have a lot of problems in the future by what's out there, right? We're going to have a lot of autoimmune. We're going to have a lot of MS, Parkinson's, Alzheimer's, cancer. It's predictable now. You can almost predict what's going to happen based on what's in the nutrition and what they're coming out with in the marketplace, right? I think we have to be careful. I think we have to do more research, more studies. I think it needs to start at the animal level and then go up to the humans. But these microbes are not benign. Some of them are really bad and should not be for consumption, in my opinion. And here's the other thing, we're all different. My microbiome is completely different than you, Michelle, completely different than you, Stephanie. I mean, I was born in Morocco. I've traveled the world. I was in the desert of Morocco. My microbiome is very different than most people. You're, Michelle, from wherever you are, you're very different as well. I think when we lose that diversity, when we lose the microbes that make us who we are, where we were from, like you said at the beginning, microbes that were passed on from grandmother to mother to child, we mess up that whole lineage. We mess up that whole diversity. I think we have to be really careful not to use the one pill formula for all, not to believe that everybody has the same microbiome. I'm a big pusher of bifidobacteria, but then when you look at the Amazon jungle, is bifidobacteria even a thing there? When you look at Africa or China, is bifidobacteria even a thing there? Or is it a thing because we've incorporated some of the diet of America, right? So we have to really preserve the microbiome of humanity. And that's something that I'm really passionate about, because the planet exists because of the diversity of the microbes in different regions. You change all that, you globalize the microbiome, you've killed humanity, you've killed the planet.
Well,
that's what we're doing with glyphosate, by the way. We're globalizing.
So this might be, we only have 2 minutes left for our show, and this was so profound. We didn't cover a lot of stuff we wanted to, but this is a massive topic. But I just want to hear a final statement from you, Stephanie. Sabine, I want to hear from you how we can reach you, and then we're going to wrap up the show. Stephanie, any final thoughts for listeners today before we begin to do our close down?
Well, one thing I would say is that eating healthy food is probably more important than taking probiotics. And I think that you eat the food that's going to help the microbes in your gut stay healthy, and they're going to balance themselves out according to their own needs. So just eat foods that are rich in vitamins and minerals, organic, whole foods, spend the time cooking natural, ingredients. I think that's really the most important path to good health, that and sunlight to get the vitamin D. So those are sort of my two big items.
Thank you. Items. And I've eaten your food, and I've eaten your husband's food, and they are walking the walk, talking the talk. Sabine, this was a great wrap up. Any final statements, and how can people reach you, please?
So they can reach me at Microbiome in the Contact Us page, and I'm always available to answer any questions. Decrease stress, Zen, don't hate, love. That's my big message. Unite the world. Create peace so that we can have a peaceful planet that can start growing microbes again, all those microbes that we've lost, and bring back the bifidobacteria. That's it.
Well, thank you. It's been a pleasure having you. So pleased for you to join us. We know how busy you are. Stephanie, again, thank you. And Temple behind the scenes. Anne, can you just pop up, because GMO Science supports this. We like to eat organic food too. So please support us and support our work. Sign up for the newsletter. We are the new MDs. This is why the new MDs came together, mothers, doctors, and scientists, so we can promote this type of thinking. See you guys next month for a Mother's Day show you won't want to miss, and have a wonderful rest of your birthday.
Thank you.
Thank you.